The following program was produced by Blue Ridge PBS and PBS Appalachia in partnership with the Virginia Department of Education to share resources for parents on problem behaviors like vaping and e-cigarettes, teen gambling, and opioid use.
What are some things that parents need to know about opioids in particular when it comes to their children?
One thing you want to know is that one pill can kill. Let your child know that you do not borrow or take an opioid from anyone who offers it to you. Now more and more there are these fake pills on the street, and we are seeing kids die. Fentanyl, for example, pressed into something that looks like it might be Percocet or Xanax. Instead, it's fentanyl. So that's number one. Don't take pills from anybody. The use of opioids in treatment of pain under a doctor's supervision is still allowable in very short terms, but typically, we look for what they call the NSAIDs, something other than an opioid to treat pain. So we're increasingly seeing doctors go that direction, and we want parents to encourage doctors to go that direction. And if you're at an urgent care and they want to send home 30 pain pills, for a child who's sprained their wrist, feel free to push back against that, because that's not really necessary.
How would you start a conversation if you suspect a child or their friends are using opioids?
Having conversations with our kids about what their friends are doing is a really great way to enter a conversation about use and the dangers of use. So I love that question, what are your friends doing in terms of what do you see going on? What are they talking about at school with regard to use of opioids? Or it could be a stimulant of some kind. I personally am very concerned about marijuana, about edibles, and about dabs that get vaped. We haven't, talked about electronic vaping. Products are oftentimes now used to inhale intense concentrates of THC that are very dangerous. So if that opens up the topic of, what I see is vaping going on, you want to talk about that. And the fact that marijuana, especially for youth, can be very harmful and dangerous. Marijuana for the developing brain has been proven to be harmful. This is not some docile thing that's like drinking chamomile tea. This is really...
Especially in the concentrates that the products are available.
Right, yeah. And if you start use young, you're more likely to be addicted. 9% of people who use marijuana will become addicted to it. That means that it interferes with their life. If you start young in your teenage years, the percent that will become addicted is more like 30%.
We think of treatment as being something you go away for 28 days because that's what insurance will pay for. What have we learned about treatment for opioids that maybe doesn't require people to go away from their family and support systems?
That's such a myth, that whenever you have a substance use disorder that you've got to go into rehab. And actually, it is very likely that you can be successfully treated in an outpatient clinic setting. And again, like I said, we combine it with therapies, we combine it with care coordination. It could be combined with family therapy, which can be very helpful, especially when you've got youngsters involved. And that would happen often very effectively in an outpatient setting.
What are some steps we can all take to keep kids safe? And I'm thinking specifically about things like the availability of medications in the house.
Yes, definitely get the unused meds out of your medicine cabinet. A number of patients that I work with, that's how they originally did get addicted to opioids, was increasingly taking more and more meds out of the medicine cabinet. You should be locking up any controlled substances, lock up your medicines, and then ones that you don't need, just get them out of the medicine cabinet.
And you could do that at pharmacies. Many police departments have take-back boxes and other places.
Yeah, we have take-back events. The Water Authority partners with a number of people to sponsor take-back events because they want you to get rid of them, but they don't want you to flush them down the toilet. They don't want all those medications in our water supply. So they've formed these coalitions to sponsor take-back days.
What is the role of the school when it comes to helping kids who may have become addicted to opioids?
Well, I love highlighting schools because I spent most of my career on a health-based program called Teen Outreach Program that really helps kids move in the direction of healthier decisions. And that's what we need in the schools, is we need these quality health education programs that are taught by people who are up to date, will give accurate information to kids, and also form relationships with kids where they are hearing it better from that caring adult because they know they have in their heart that child's best interest, right? So they're going to pay attention. It's not just a lecture. It's a part of a whole program designed to bring out the best in kids and help them achieve their own goals. So quality health education in the schools, also bringing in supports where children's health care needs can be addressed right there within the school. I urge parents to support these school-based clinics. Sign off and give your child permission to use them, because meeting their health care needs is going to help prevent some of these risky behaviors. When you're paying attention to that child's health and wellness, you're going to prevent some traumas and set up, the stage for a healthier life and better decisions.
If you'd like more information on how to talk to your kids about dangerous behavior, visit the Substance Abuse and Mental Health Services Administration website for families at samhsa.gov/families.